Hello, my name is Pauline Burciaga, and today I'm going to be talking about the discrimination against Hispanic slash Latinx culture in the healthcare system. So some terms to understand. Hispanic refers to people who are from Spain and speak the Spanish language. It does exclude Brazilian people who mostly speak Portuguese. Latinx is a gender neutral term for people who are related to Latin American descent. It's mostly tied to geographical regions. The term Hispanic has been highly rejected because of ties it has to Spain, so people may use Latino as an alternative to Hispanic. However, Hispanic and Latino can be used interchangeably. Lastly, implicit bias are the attitudes and stereotypes that affect our comprehension, actions, and decisions in an unconscious manner. So pretty much we're not aware of those attitudes. What does it mean to be Hispanic? So part of it is language because that's the way that they are able to build community and connection with one another. Some of the beliefs and values that they have are importance of family. So they're very family oriented. Their religion, most Hispanics have the religion Catholic, and they need to display of mutual respect, and they like to build trust. They also have the belief that good and evil spirits can affect the well-being and spirit of the dead. And I thought this was pretty interesting, the 5 F's of Hispanic culture, which are family, fiesta, faith, food, and football. And this is a quote that I found on Carter Blood Care in 2015. Hispanic is the foundation with which people are able to associate and helps them define their roots to discover who they are and who they can become. And a little picture on the side that just popped up. Okay, a brief early history of Hispanic culture. So the ancestry of Hispanic and Latino culture can be traced back to the indigenous people of North America, Spanish slash European, even Asian and African. In the 17th and 18th centuries, the southwestern region was considered part of New Spain. In the 19th century, this region was considered Mexico, and from the 1846 to 1848, the Mexican-American War led to the fall of Mexico City, which was the capital. In 1848, that's when the Treaty of Guadalupe Hidalgo was signed by Mexico and the US, and pretty much the southwestern region became the US we know today. Some of the struggles that they went through and still maybe going through the discrimination and segregation. Pretty much a lot of it was punishment. Back then was punishment for speaking Spanish in public schools, segregation in restaurants and in jobs. And then this welfare reform legislation that was signed by Bill Clinton became a big problem for Hispanics. Those who were on welfare had to work after 2 years of assistance in order to continue to receive those welfare benefits. So this made it difficult for Hispanic elderly who immigrated to the US and never applied to be a citizen. And also, these people were at risk for losing Medicare and security benefits. And I thought this was a pretty fun fact. Hispanic population in the US now, in 2019, the Hispanic population reached to 60.6 million in the US, which makes them the nation's second fastest racial ethnic population group after Asian Americans. And then here we have discrimination in the US against Hispanics overall. So I took this from a Pew Research study. So people were surveyed, and roughly 52% of Hispanics reported that they have experienced discrimination or have been treated unfairly because of their race or ethnicity. It does vary by age, so 65% of them were 18 to 29-year-olds, and in contrast, 35% of them were 50 and older. People born in the US versus immigrants, so 62% of them were US born and 41% of them were immigrants. And then also discrimination, or they've been treated unfairly, were the ones also for education. 40% felt that way, less who had less than a high school diploma, and 50% of them were high school graduates. 61% of them have some college. So there's a study on Hispanic and healthcare done in 2015 in the state of Oregon, Oregon State University to be exact. So pretty much young Latinos living in rural areas experience discrimination while obtaining healthcare. In the study, there were 349 Hispanic participants from ages 18 to 25. Almost 40% of those young participants had experienced discrimination in a healthcare setting, such as prevented access to services, they were being hassled, or being made to feel inferior. And then, why does the healthcare system treat Hispanics differently? Well, in 2015, there was an annual reviews article that discussed how there's a bunch of documented studies that show how Hispanic and Latino culture or population tends to have worse access to healthcare, experience more disease symptoms, and receive poor quality care compared to the non-Latino whites. And the reasons for this: Hispanics have lower rates of insurance coverage, so non-citizenship, or they have low wage employment. It also could be their geographical location, so rural areas, such as discussed earlier in Oregon, limited comprehension or patient-centered care, so they lack respectful care. And then this can affect or be going into implicit bias. So once again, the definition right here: the attitudes and stereotypes that affect our comprehension, actions, and decisions in an unconscious manner, not being aware. So there was a study where approximately 2/3 of primary care providers demonstrated implicit bias against Hispanic community. Research that has also found clinicians to often show implicit biases towards the level of intelligence of their Hispanic Latinx patients. And this reflects on the level of treatment given. So this is important because the attitudes of clinicians can be a contribution to the treatment patterns. So why is this a problem? Hispanic Latinos are less likely to seek healthcare services and are more at risk to have high rates of chronic disease, such as diabetes. So this can impact their overall health and their overall well-being. These are my references, and that is all I have for you. Thank you very much, and have a wonderful night.